And the topic I want to talk about right now is front office. And obviously, at Patient Prism, we're deeply involved in looking at how front office effectiveness works. And we've seen lots of challenges come about. So a lot of dentists ask me is that how do you effectively hire the right people at the front, because it can make or break your practice. Obviously, if you can't book the patients, if the first impression is bad, everything is kind of goes, the patient doesn't make the appointment. So what's the strategy to really recruit the right person at the front, and then keep them engaged, motivated, and perform at their peak?
It starts with finding that right person. But you touched on something in the beginning, which is important, is that the dentist knows it's a pain point. A lot of dentists don't realize it's such a critical position. So it starts really there. Understand that this person is making the first impression of the practice, and many times the last impression. They're on the walk in and on the walk out, right, with that patient, and they can fix anything that happened with a really nice farewell, or they can ruin it by not even saying goodbye. So it's knowing that that's a key position. Start there, and then find somebody really nice, really happy for the job. That to me is the job requirement. Everything else they can learn. Those are the things you can't put in somebody.
Right.
And so I use the example at 1-800-DENTIST, we all we get is to talk to them on the phone. We're trying to create the first impression of that practice. I hire people that can be nice and happy all day, that are compassionate and non-judgmental and know how to listen. And then I train them to do everything else. I don't expect them to know anything else. But I want that quality in them. And so it starts there. So don't be afraid to go out of dentistry to find somebody. Find somebody, if you find somebody else, somebody working at the counter at Macy's or whatever, and you just go, this is a fantastic personality. Some people are like that. Some people wake up with a smile on their face. It's got nothing to do with anything. They're just that way. Get those people at your front desk.
And paying them the right wage is also important, right? I mean, Howard Farran talks about we don't even name them. We call them by furniture. It's front office people. I'm like, okay, what does that really mean? It's front office. So really, they deserve the same amount of respect that everybody else does, obviously, as human beings. But a lot of people think that it's just an answering position where all they do is somebody's taking a message for me, but it's not.
Yes.
Right?
Yeah, they look at it like a parking lot attendant or something like
Right.
that, and they underpay that position. I'm constantly telling doctors, overpay that position, because you want them to stay and you want them to feel involved in the practice, and you want to attract somebody. So retention is important. You don't want constant turnover there, but you pay somebody just slightly above minimum wage, or what's impossible for them to actually own a car and have an apartment. They're not going to be working for you. They're going to be online looking for a job while they're sitting at your front desk.
And then you expect them, after paying them that, then you also expect them to do other things.
Yes.
Because you want them to be busy nonstop. I mean, how many times have you seen that happen?
Well, yes, it's like, they weren't doing something for 20 minutes. We need to give them tasks. And
Right.
now, so you give them a task,
Right.
now they don't answer the phone anymore.
Right.
So more and more practices I see are figuring out that they don't need one receptionist, they need two. Because you want spare time. You want to always pick up the phone within 3 rings. When you're not doing that, you've missed the basic.
Absolutely. We've seen at Patient Prism so many times that there are practices that we onboard, and 30% of their phone calls go to voicemail during business hours.
Yeah, when they're
How
open.
is that acceptable?
Yeah.
I mean, I just don't understand. And then you say, "Oh no, we can't afford a new receptionist." How that math doesn't work?
No, and we could get into the economics of it, but a good receptionist, a great receptionist, is going to bring you one great case a year that's going to pay her entire salary. That's the reality. So that's how you really have to look at it. Say, like, I've got all year for her to be a free employee,
Right,
just
right.
by having her
One
be great,
case.
and by paying her maybe $35,000 a year instead of 30, or whatever the heck that is. And then you want to retain them, so you have to incentivize them.
Right.
You give them opportunities to participate in the bonus, in the success of the practice.
Right.
You give them opportunities to fill the schedule and bonus them on that. Convert higher. You know, if their conversion is at 50%, there's a bonus when it suddenly hits 60. The opportunity to do well and earn more. Dentists, you know, a lot of us, you know, you and I make good money. It's easy to forget what it's like to not be able to put gas in your car. But there's half the population in America lives exactly that way. They're making decisions of, if I do this, I can't do that.
Right. And like you said earlier, that most position dentistry, there is no upward mobility.
Yeah.
So they can't. They have to be receptionists. Pretty much, they cannot become anything else.
Right.
Unless
They're going to go to school to become a hygienist.
Right.
They may get to be an assistant if they decide to train for that.
Absolutely.
But so you've got love and money. So you create a great place for them to work, and you bonus them, and that's how you keep happy employees. You know, consistent employees that create a great culture, which is what the patient is going to respond to. It all comes down to when that remarkable experience is happening, the patient is going to accept more treatment. And that's what you're creating an environment for. And that's for the benefit of the patient. When your patients are accepting the treatment they should have, you're doing what you should for the community. For that, the practice is fulfilling its purpose.
Makes a lot of sense, Fred. Thank you.